Advanced stage diffuse large B-cell lymphoma can be cured with conventional chemoimmunotherapy treatment strategies, but unfortunately we have around 30 to 40% of the patients that are eventually primary refractory to first-line treatment, or that eventually they achieve a metabolic complete remission, but they have a relapse of the disease later on. So those patients with primary refractory disease or patients with early relapse, and we consider early relapse when the relapse comes during the first year after the end of first-line treatment strategy. So when we talk about third-line setting, we have to take into consideration, first of all, the type of patient, the age of the patient, and comorbidities that the patient has beforehand. We have to take into consideration the prior lines of therapy that the patient has received, and of course the length of the complete remission that the patient has had with respect to the prior line of therapy. We have to take into consideration that around 50 or 40 to 50% of the patients are going to relapse. In the third line setting, we have different treatment options, and one of the treatment options that we have nowadays are the use of bispecific monoclonal antibodies, and this could be one of these strategies. The treatment landscape of patients with multiply relapsed or refractory diffuse large B-cell lymphoma has significantly changed over the last few years. In the past, when we were talking about patients with multiply relapsed or refractory diffuse large B-cell lymphoma, we were basically thinking about additional chemotherapy-based treatment strategies. Nowadays, in addition to the conventional and standard treatment strategies, we have new treatment options. I am in favor of share the decision-making process with the patient and also with the patient caregiver. When a patient with diffuse large B-cell lymphoma has already failed not only one, but several lines of therapy, we are usually facing a patient that is very knowledgeable about his or her disease, and it's knowledgeable about the potential long-term outcomes and the potential treatment strategies that we can offer. I also try to tailor as much as possible the information that I am giving to the patient and to the caregiver.